Good afternoon, everybody in the room. It's more and more filling up now. Every time when I listening to my colleague there, Dr. Notcutt, I'm more and more convinced by the year that we are dealing here with some kind of wonder drug, which on one side it might be, but on the other hand it is not. And one of the things he also told us is that about the street cannabis and the problems there with the street cannabis, and that is where we try to find a solution through our company. Today I would like to tell you a little bit more about basically about what happened in the Netherlands in the last 10 years, but I will go there by starting on a more global scale. Tell you a little bit about the history, a little bit about cannabis as a medicine, although you heard a lot of it about it already, and then goes a little bit deeper into the Dutch model, what we have created in the Netherlands, and a little bit about the company that is actually producing cannabis of pharmaceutical quality, as we call it, in our company, and to be used as a medicine, but also as a raw material. Cannabis or cannabis extracts used to be a very regular medicine in the 1800s until the 1900s, early 1900s. And of course, cannabis was used those days not only as a medicine, it was also used as a building material, as a material to make things like parts, car parts. Henry Ford, the Ford company, was already using cannabis in that time. And economically, cannabis became kind of a danger to paper industry, to the nylon industry, which was upcoming in those years. Powerful economic issues were at stake, and that led basically to the prohibition of cannabis in those years, starting in the USA. Of course, this prohibition excluded medicinal use of cannabis, but while it was not proven that cannabis was a real medicine, slowly on, after the prohibition started, it was taken out of all pharmacopoeias all over the world. And one of the latest I just learned this morning from my colleague William, it was in the early 1970s, it was taken out of the pharmacopoeia in the UK. The whole situation started to change when in 1964 THC was discovered in the plant. And in 1988 it took 24 more years to discover THC, or the THC receptor, in the human body. That led to the fact that more and more people, politicians also, were starting to think about cannabis as a medicine and to bring it back into the pharmacopoeia, to bring it back into the pharmacy especially, because many doctors at that time already were saying that they needed cannabis because it had a total different way of working in the human body compared to opioids, for instance. That was the reason that following the UN regulations, two countries basically in 2000 said, okay, we are going to allow cannabis as a medicine. We do it through the regulations as they are there. And for that purpose, those countries had to establish a national agency that takes control over the production of cannabis and the distribution. And Canada and the Netherlands established such an agency in the year 2000. In the Netherlands, that led to the starting of sales of cannabis in 2003. A little bit earlier in Canada already it was allowed, I think, in 2001. A very little bit about cannabis as a medicine. People like to smoke joints for a reason. They think that inhalation, that what you inhale, then okay, that is good for you, but essentially when you smoke cannabis or you heat it up, you change actually the active compound in the drug itself from an acidic compound into non-acidic compound THC, and that is where the psychoactive compound is coming in. The same applies, by the way, to cannabidiol, CBD, which is only available in the plant material in an acidic form. So you can use it then by smoking it, but that is not advised. Eating cannabis and preparing it yourself is also a tricky thing, because there might be differences in the product you have been producing. Some cannabis may be more available on certain spots, and in other spots it may be less available, making it difficult to titrate. What is advised in the Netherlands nowadays is to make a herbal tea of cannabis that will not contain only THC, it also contains a lot of THC acid, which is in itself also an active compound. And it is advised to vaporize cannabis, so through inhalation of the lungs, because it's a very effective way of taking in, especially for fighting pain. The most important indications for cannabis to be used in the Netherlands is for cancer during chemotherapy, when people suffer from nausea and lack of appetite. The same counts for HIV and AIDS. And for multiple sclerosis, but for multiple sclerosis it is advised to fight spasms and pain, especially neural pain, which comes along also with multiple sclerosis caused by neural damage, spasms like in Tourette syndrome, and glaucoma. Those are the main diseases for which cannabis is now advised in the Netherlands, and just recently they added ALS also to that list. Research is ongoing on certain psychological disorders like ADHD, bipolarity, and post-traumatic stress syndrome, and the inhibiting cancer cell growth. There are technical studies now right now going on, in vitro studies as they call them, not in humans but just on the level of cells. So what do these different active ingredients in cannabis then do? Well, THC is now known to fight nausea, pain, appetite, and to promote sleep, especially. Cannabidiol, CBD, is getting more and more used for psychosis, inflammation, anxiety, and also in cancer studies it has shown that CBD has a certain effect. CBG, cannabigerol, which is basically a precursor of THC and CBD, helps to find pain, inflammation, and has an antibiotic activity also. The fourth compound, which I would like to emphasize on here, are the terpenes. I will come to that a little bit more later, but terpenes are the compounds that make cannabis smell, give its typical smell. The cannabinoids don't have any smell. Let's be very clear on that. Many people think that they can smell the active compounds in cannabis, not the cannabinoids. Terpenes are fighting infection, are helping to fight inflammation, and also are known to be helpful for people in depression. Terpenes are basically also the stuff that makes the dog bark or sit next to you very kindly when you are on the airport and you are having some on you. The most known active terpenes in cannabis are beta-caryophyllene, humulene, and myrcene. So where are we today with medicinal cannabis in Europe? There are now, or in Europe, in the worldwide basically, there are national agencies in Canada, in the Netherlands, and only recently also in Israel and in the Czech Republic. So in those countries, production of medicinal cannabis can be allowed. There is a regulation for it. Also, the USA has a national agency which is embedded in the National Institute on Drug Abuse, and the world is already saying it. They are only studying drug abuse. They are not studying the good sides of the cannabis. They are only studying the bad sides. For that purpose, there is one production unit active in the United States, which is the University of Mississippi. Dr. El Soli is doing there his production and his studies on cannabis also. And there is a very tiny bit going from there to only, I think, now 5 patients left in the US. They were allowed to use cannabis to fight their diseases in the early 70s, before the drug on wars in the United States really started. So medicinal cannabis is then legally available now in Canada, in the Netherlands, and in Israel. Through the Netherlands, there is some export to countries, to other European countries like Italy, Finland, Germany, and only lately in Switzerland this year, and it is also now allowed in the Czech Republic, and that's only very recent, but maybe you will tell a little bit more about that later. And of course, there is this huge medical cannabis industry in the USA, and many people are wondering, you know, what is the difference then? Well, the difference is basically in the production chain. Everything that is allowed in the United States is all that is allowed in certain states, especially, I think it's now 16, is the use of cannabis as a medicine, not so much the production. If patients want to produce their cannabis, they are allowed to do so, but there is no controlled production chain in the USA. So there's basically no standardized cannabis, and the word is coming up. I will come to that later, the standardization of cannabis. Okay, the Dutch model. I'm focusing now a little bit more on what is happening in the Netherlands. So we have there this Office of Medicinal Cannabis, which is embedded in the Health Ministry. The Office of Medicinal Cannabis is the national agency as required by the UN regulations. And this office is taking care of proper cultivation, quality control, which should happen in an independent laboratory, so that's not something we are doing. And also the packaging, which is done by a pharmaceutical wholesale company that is responsible for making the smaller dosages of cannabis, which are then brought to the pharmacy and also are available for research and for the export, as mentioned. Sorry, I have to go back to this one. The fact that it became possible in the Netherlands, I would like to tell a little bit more about that in between, was that our Minister of Health in the late 90s was basically under pressure to allow cannabis on the market, but there was another fact too. Her husband in those days died of cancer, and during his last months that he was alive, he was treated with cannabis also, and she was basically kind of upset about the fact that there was no controlled cannabis available at that time, and that was one of the reasons for her, among more, but that was one of the reasons for her to make it available. So it was not enforced by activist movements or whatever, it was basically coming from the inside there. Bedrocan is the only company in the Netherlands now producing medicinal cannabis for the government. Initially there were 2 companies. One company did not survive because of basically a lack of standardization in his products. Bedrocan company is a long time there, almost 30 years now, and started as a company for the production of vegetables only indoors. So we were from the beginning specializing in indoor production and standardization of your products. In 1992, the first thing we got in touch with cannabis was for the production of cannabis seeds, which at that time was legal in the Netherlands. So cannabis seeds are still legal in the Netherlands, only the production of them are now under a license. Bedrocan got its first license for production in 2002 after the regulation came into force in the Netherlands. And that first license allowed us the production of what we call now cannabis floss. Cannabis floss is basically the word for dried female flowers of the species of Cannabis sativa L, as mentioned it. And in 2003, the company started to produce on the basis of the demand in pharmacies. Well, that demand was not that high. The production of us, together with the other, we produced 40 kilos. The other company only produced 30 kilos at that point. So all in all, what was needed at that time was 70 kilos in the first year, which was basically, to the surprise of many people, not that much. The company got ISO certified on the quality management system we developed in 2008 after 5 years. So cannabis is now produced under full quality management system. That means that you have standard operating procedures. Everything is done according to those procedures and protocols, and everything is in conformity with the pharmaceutical regulations for production of herbal medicines. Another milestone was 2011 when a big health insurance company in the Netherlands decided to allow 100% reimbursement of cannabis for everybody in the company that was insured with their company. This company decided to do so because they had seen a lot of positive effects of cannabis on patients. Those patients were getting off regular medicines, were getting out of nursing homes, were getting out of hospital while using cannabis. So that was a very cheap solution for them to help these patients further, and the cost effectiveness for them was very important there. That led for our company to an increase of demand, and we had to double our capacity last year to a level of now 400 kilos annually. Bedrocan in the meantime structurized. This is the original company, basically, the raw material production. But while we found out that research development, that there needed to be done a lot more, we also established a research and development department, all functioning under a holding company. The raw material production goes all straight to the Dutch Office of Medicinal Cannabis. Through our R&D department, we are providing information, and we help this company, which is called Spirocan BV, and that company is now busy developing registered medicines on the basis of herbal cannabis. We don't make extracts there, we just use herbal cannabis as for the basis of registered medicines. Spirocan especially is focusing on inhalation device, while inhalation is the most wanted and the most preferred route by patients. 2 years ago, an international study was done on the preferred way of using cannabis by the IACM, and the results showed that inhalation was the most preferred way of doing that. So that's why we are focusing in this company on development of such a device. Of course, we are working also on production in other countries. While the Dutch government restricted the amount to be exported, there is a possibility for other countries to also produce Bedrocan products there. And from there, both products go to pharmacies as well from this company as from that company. Later on, this is not yet ready. Talking about standardized production, what does that mean? Well, in the end, of course, it means that your product is always the same. To get to the standardization, to the level of standardization we want to be, we use genetic stable varieties. We have different cannabis varieties containing different amounts of active compounds, and we are using stable genetics to come to that point. We only produce indoors. We have indoors fixed schedules for growing, we have fixed schedules for processing, so basically it's an industrial way of doing things, and that allows also to make our system modular, which is easy then to build out on. All the active substances in the cannabis are within standard pharmaceutical limits, and that is all based on science. That's the way it goes. A standardized product then looks like this. We have 10 different batches in a row produced in 1 year, and the allowed deviation, so the allowed difference, is 15% or 20% of the declared value, which is regular for herbal medicines. And for instance, the variety Bedrocan is within those limits all along, and there are no differences there, and so it's usable as a real medicine. What is then available now in the pharmacy in Holland? We have basically 4 varieties available in the pharmacy. Bedrocan containing 19% of THC, Bedrobinol containing 12% of THC, Bediol containing 6% of THC, but 7.5% of cannabidiol too. The What we call the AI94 is an only cannabidiol containing variety between 8 and 9%. And then we have Bedica containing 14%. Many people are asking us, you know, what's the difference then? Because it's only a little bit THC, higher or lower. And then we say, no, there's this other compound, those are the terpenes. And when we relate to what people on the street are telling about cannabis varieties, we can relate that to sativa and the indica varieties. While Bedica is a true indica variety, indica you can recognize on the morphology, so the shape of the plant tells you if it's indica or sativa. The other three are mainly sativa varieties. And there's a difference for many people in how the product then works for them. What we have concluded so far is that the big difference is in the terpenes, and already other studies have shown that there is a synergy between terpenes and cannabinoids when used together through cannabis. There is an increasing demand nowadays. In the beginning, the demand slowly went down. There was a lot of opposition, not only from doctors in that time, but also from in Holland, the famous coffee shops. People working there were not happy about the legality of the products, and there was a lot of opposition. They used the media to tear the product down, to say that it was what they call state weed. So cannabis grown by the state that could never be good. But after quite a huge court case in 2006, where Bedrocan was acting as a court witness, we don't know if that has been the reason, but from that moment on, the demand started rising, and till 2010. And in 2011, when full reimbursement came available for most of the people in Holland, we see even a bigger increase of the turnover right now. And this is all based on the number of prescriptions. So this is not based on what we are doing in our company. This is totally based on the number of prescriptions done given by doctors in Holland. Bedrocan in other countries. Is that possible? Is it available? Yes, I already told you that in Italy, Finland, Germany, Switzerland, Bedrocan is available, but that must be done through politics. While cannabis is not yet a registered medicine, it's just depending on, as we always say, the goodwill of the politicians to allow it or not in a country. Germany, Finland, Italy allowed the import of cannabis by an import license, while other countries are not that far yet. Importing from the Netherlands is for the governments is quite easy thing, although it's expensive for patients. To give you an example, in Holland, patients are now paying around €8 a gram for cannabis in the pharmacy, while in Germany, you know, it's 50 kilometers on the other side. People are paying between 15 and 16 euros for that exact same gram. What causes that? All kinds of regulations, import regulations, relating to it. There's a lot of things involved with governments, and then going to a pharmacy in Germany, and they make the profit as well. So that's expensive for patients. The procedures there are lengthy, and the Dutch government only allows small amounts to be exported, up to at the most 100 kilos a year, and then they say it's cost effective to produce it in your own country, so do it there. We are not the cannabis dealer of entire Europe or the entire world. So startup of local production is another option. It is possible for us as a company to go abroad and to cooperate with local companies in other countries and to set up local production in other countries. That is difficult for governments, however, because then they have to establish an office of medicinal cannabis and to take control over the whole production chain. And many countries don't want to do it, and I applaud the Czech Republic for doing it, because it's a very difficult thing to do. We have seen it in Holland, and it was not easy. But in the end, it will be cheaper for patients. It will give better access to patients, and there are, of course, no limits in amounts. Whatever is required can be produced in such a country. Well, that was basically what I wanted to tell you about this morning. If there are any questions, I'm happy to answer.
Ευχαριστούμε τον κύριο Erkelens.